under control. Mr. Speaker, I now want to turn to the operational issues on data publication and the future plans for medicine licensing and, of course, the announcement of 40 hospitals made by the Prime Minister on Friday night. Mr. Speaker, I want to take the first available opportunity to set out to the House the technical issue around case uploads discovered by Public Health England on Friday evening. This is an ongoing incident, and I come to the House straight from an operational update from my officials. On Friday night, Public Health England identified that over the previous 8 days, 15,841 positive test results were not included in the reported daily cases. This was due to a failure in the automated transfer of files from the labs to PHE's data systems. I want to reassure everyone that every single person who tested positive was told that result in the normal way, in the normal time frame. They were told that they needed to self-isolate, which is, of course, now required by law. However, these positive test results were not reported in the public data and were not transferred to the contact tracing system. I want to thank colleagues who've been working since late Friday night through the weekend to resolve this problem, and I want to set out the steps that we've taken. First, contact tracing of these cases began first thing Saturday. We brought in 6,500 hours of extra contact tracing over the weekend, and I can report to the House that as of 9 a.m. today, 51% of the cases have now been contacted a second time for contact tracing purposes. I want to reassure the House that outbreak control in care homes, schools and hospitals has not been directly affected, because dealing with outbreaks in these settings does not primarily rely on this particular PHE system. Second, the number of cases did not flow through to the dashboards that we use both for internal and for external monitoring of the epidemic. Over the weekend, we updated the public dashboard, and this morning the JBC presented to me their updated analysis of the epidemic based on the new figures. The Chief Medical Officer has analysed that our assessment of the disease and its impact has not substantially changed as a result of these data, and the JBC has confirmed that this has not impacted the basis on which decisions about local action were taken last week. Nevertheless, this is a serious issue which is being investigated fully. I'd like to thank Public Health England and NHS Test and Trace, who've been working together at speed to resolve this issue, and I want to thank everyone for their hard work over the weekend. Mr. Speaker, this incident should never have happened, but the team have acted swiftly to minimise its impact, and now it is critical that we work together to put this right and to make sure that it never